Welcome back. The next story looks at a growing problem in America, falling. And although most of the data refers to people over the age of 65, the trend is growing in adults aged 40 to 55 as well.
A fall is any time you come in contact with a supporting surface that you did not intend to contact, whether that be a floor or a chair or a wall, anything that you strike that you did not intend to be there, whether or not there is a reason behind the fall or not.
Our population is aging, and the already significant financial impact of fall-related injuries could very easily become staggering. Currently, the Centers for Disease Control reports a little more than $19 billion is spent annually on treating the elderly for the adverse effects of falls. $12 billion for hospitalization, $4 billion for emergency department visits, and $3 billion more for outpatient care, mostly paid by Medicare. It's projected that direct treatment costs will reach $43.8 billion annually by 2020, at which time the cost to Medicare would be $32.4 billion.
That's not Medicaid, that's just Medicare dollars. 1 month in a nursing home for rehab care costs between $6,000 and $12,000. Running a fall prevention program costs about $200, $250 and can include up to 12 to 15 older adults. People who have used fall prevention programs show a decline in falls of approximately 20 to 33% depending on the program and the reporting of the statistics. If we prevent one fall, we save the system, the healthcare system, approximately $14,000 for one person if they just go into the hospital or treated and go home. That does not include long-term care. Of the people age 75 and over who fall, 20 to 30% are injured. Of those that are injured, 25% will die within a year. The cost is huge.
And far outweighing the financial burden, falls in seniors dramatically impacts their quality of life. Many who suffer a serious injury will not survive more than 1 year after the incident. Many more will lose their independence and be forced into expensive, long-term medical care.
The problem in the United States is that our medical system is based on caring for illness and injury and not on prevention. And the only way to get prevention out was through a different avenue.
That different avenue is by establishing the Nevada Goes Falls Free Coalition, part of a national effort by the National Coalition on Aging. With statewide community partners, including the Southern Nevada Health District, its goal will be to raise awareness of fall prevention to seniors, their families, and healthcare providers to allow our older residents to safely age in their own homes.
The intent of the coalition was first to identify in each state who was doing something about falls, who could be doing something about falls, and who should be doing something about falls, and bring them all together.
And so we're kind of formally uniting advocates in Nevada, because part of getting the more people you can get together and work together, the better chance we have of actually being successful in getting the information out to the public.
Fear of falling is rampant amongst older adults. They fear talking about it will result in them losing their independence. They are afraid, and because of the fear of falling, they become physically inactive, which means they become more isolated, depressed, and it just begins a downward spiral. And it's the worst thing you can do, but it's very understandable why that would happen. So we need to reach out to these folks and educate them and empower them to make choices of good, safe physical activity that will decrease their fall risk, allow them increased social interaction, get them out of their homes that they may be locked in due to loss of driver's license or whatever has occurred.
Dr. Lisa Rosenberg specializes in geriatrics at Touro University, as well as co-chairing its committee tasked with developing its aging center.
It's actually a tremendous problem, and it's underestimated by the public in terms of how often it happens. It turns out that about 1 in 3 older adults, older being over 65, will fall within a year, and half of those will fall again.
Touro University, Nevada is partners in a federal grant with UNR and UNLV, a geriatric education center grant with UNR as the lead. UNR focuses on the educating of health professionals in geriatric attributes and health literacy, which is looking at how patients don't always understand the information that health providers are trying to give to them, and how to help the patients and family members better understand the information. UNLV's part of the grant is in training health providers in chronic disease management. They're focusing on their large patient simulation lab and doing diabetic training and diabetic management with health professionals.
Touro University has the falls management and prevention part of the grant, and our purpose is to educate health professionals throughout the state in falls prevention and falls management, and also to put falls prevention and falls management into the professional curriculums of healthcare providers in the state.
Now with our funding for the Nevada Geriatric Education Consortium, which is a federally funded consortium with UNR and UNLV, our partners, we are really focusing on falls and focusing on educating clinicians, physicians, PAs, physical therapists, occupational therapists, and nurses to really ask about the symptoms that are associated with falls. So the first part of spotting it, as you say, for a physician is to ask the right knowing to ask the right questions. Falls is coming more and more on the radar at a national level for a couple of reasons. The first is that 20 or 25 years ago, we didn't know falls were something that we could prevent. It was not an entity that was studied and understood to the degree that it is now. And the second issue is the baby boomers all coming into that 65 and up group. So we have a 20-year cohort of people that are going to age. They're going to hopefully age better than generations in the past, and they're going to be with us longer.
Here we are in this aging population who is not aware of the risks of severe injury and how it affects their lives. And so that's a whole project of trying to make people, as you get older, aware that your risks of falling increase, but there are things you can do to reduce the risk. Again, you can't reduce everything to zero, but you can significantly reduce risks involved with having a fall.
So, what are some of the significant risk factors for falls in seniors?
There's 4 major factors. One is getting older people to exercise, and in particular do kinds of weight-bearing exercises. Doesn't mean you have to go to the gym and lift heavy weights. You can use your own body weight for many of those. The second thing is making sure your vision is correct. If you need glasses, that your prescriptions are kept up to date. And third thing is your home living environment. There's things you can do within the home. You make modifications to your living environment. What you're doing is trying to reduce the risk of falls. And then the last one is medication management. You know, as we age and various things happen to us, we tend to be on medications. Many seniors are on multiple medications, and they don't get good guidance from their doctors.
If your doctor adds a medication, especially something like an antidepressant or a blood pressure medicine that lowers the blood pressure, if that makes you feel dizzy or confused, so pain medicines will also do this. Muscle relaxants will do this. So anytime you notice that you feel funny or lightheaded or like you've had a beer, which is what people have told me, oh, I feel like I've had a beer, and that's not a good way to feel when you haven't had a beer. So those are things to look out for.
The whole idea of falls prevention is to become more aware of the hazards or contributing factors and do the best to reduce them. Reducing hazards around your home protects all of its residents. Keeping aging in mind when renovating your house would be a good idea as well. All of the experts we spoke with encouraged regular physical activity. But wouldn't increased physical activity also expose a senior to additional risks of falls? Well, apparently, it's all in how you modify those exercises.
Doing them very logically and realizing your body at 65 is not your body at 25. When we exercise, we need to warm up and cool down much slower and much longer. We need to monitor our heart rate, and where some of us have been taught to calculate a target heart rate at 80% of our max heart rate, we should really be exercising at 60% as we age. Before you start exercising, even just a stroll and easy walks, you need to speak with your healthcare provider and make sure what is safe and what is not. When you go out to walk, you choose the right shoes. You can no longer run out in flip-flops and get away with it. It's one more risk factor on top of your age and other things that are happening. So the way that we are physically active has to be suited to what we've been doing and to our age.
It's true that a lot of patients are reluctant to tell me the changes that they're experiencing because they're worried about losing their independence. I think that for a lot of older adults, it's actually that I don't think they decide not to tell someone. I think they just go, I didn't fall, I didn't get injured. And it doesn't occur to them that that could be a serious thing.
The prevention and risk, that's our community. That's our public health issue. Preventing, and we're never going to be able to tell how much money we save. If I don't have a fractured hip, there's not a bill to say that.
A number of agencies can provide assistance to seniors, their families, and caregivers in our community. And a surprising number of the resources are free.
I think it's important that people understand that if they have a physician and if they are on Medicare, a preventive annual visit is now covered under the Healthcare Reform Act for everybody who has Medicare to talk about prevention and have it paid for. And I think it's important that people understand that. That includes falls.
Here in Henderson, the Parks and Recreation and the senior facilities always have exercise programs. There's those fact sheets if you go into any of those centers. They have home checklist fact sheets. They've got come to a program on falls prevention, family members. Our hospitals have falls prevention workshops, and most of these are free.
The Older Americans Act funds all of what we call wraparound services, the things that the medical insurance doesn't pay for and a lot of people can't pay for. The Meals on Wheels, the Senior Center, the exercise programs at the Parks and Rec Department that aimed at seniors that have subsidies for seniors. They're all funded through the Older Americans Act funding coming from a federal to a state level. And it's, number one, very important to protect that funding, and number two, to know that it's there. And your area agency on aging can help you find what services work for you and how to have them paid for.
Fall Prevention Awareness Day is September 23rd. More information will be available at the Nevada Goes Falls free website. This summer, Touro University will be holding falls and mobility clinics on the first and third Wednesdays of each month. And of course, more information on falls prevention is available on our website, gethealthyclarkcounty.org, or by calling the Health District's Office of Chronic Disease Prevention and Health Promotion at 759-1000.